Last year, too, we learned about the importance of cooperation and how to enrich the issue-solving tools of science through interdisciplinary work. How can math, for example, big data, chemistry, anthropology, sociology, even sociology, dialogue with the medical community? How can industry and academy and science collaborate to achieve a better future?
Cooperations are existing. Actually, they have been existing for a while. Maybe what is different in nowadays, if you compare to the 18th century, for example, the scientists were, they were biologists, they were mathematicians, they were physicists, they were sometimes also medical doctors, and they were in addition sociologues and also philosophers. Now we are in a world that is very much specialized. So the scientists are very specialized, yes, yet they work together. And you need different expertise and different fields of research to resolve the big issues. But you find mathematicians in the field of biology, like also physicists in the field of biology. In biology, for example, in life sciences, the technologies have tremendously evolved. And it's also thanks to the work of mathematicians, physicists, to also come to this complex equipment that we biologists are using. We wish most likely that there will be more interactions, and it's not always easy to find frames where you can also, let's say, think forward together with scientists of other disciplines. But maybe this is, the point of conferences or events such as the event of today that also allows to, the people to be brought together and think ahead and differently.
We'll start also here. Such complex problems cannot be solved by just one discipline. Of course, when, just as Paul said, we are now very close to have vaccines, and that's the result of years of very basic research, but also clinical trials. We need to also listen to people to make sure that they have confidence in the science and that they take the vaccines, because we don't want to end up with vaccines that work and then people don't want to take them. That requires involvement of social scientists, of anthropologists. We at our London School of Hygiene and Tropical Medicine, we have about 30, 40 mathematical modelers, and they're very active in trying to estimate not only where is this epidemic going, but what would work, what not, what's the kind of level of coverage of vaccine that we need so that the whole of society is protected. That is done by this kind of work. But also thinking of the future, we need to work with in a spirit of One Health. That means the health of people, of us humans, but also of animals. Because when you look at all these epidemics, these emerging infections from influenza, the flu that changes in nature, and or HIV or Ebola or SARS, they originate in animals. And so by working very closely with veterinarians and with people who work on animal health, we may be able to predict much faster and earlier where the new epidemic is coming from. But I'm a strong believer that we need this collaboration of various disciplines, but also between industry and academia. I mean, a lot of the basic research is done in academia, but who makes the vaccines? That is industry. I mean, industry has the ability for high quality products to produce them at the scale of billions, because that's what we're talking about. So for me, it's a no-brainer. If we don't collaborate internationally, cross-discipline, business and academia, scientists and civil society, we're going to lose. The virus will win.
Well, different parts, like Professor Piot is saying, are good at certain things, the basic science, but also implementation. Where we as the industry are good at is translating this science into products, and that's our role. We bring a lot of scientific disciplines together, whether it is cellular biology, virology, data science, everything, a clinical trial experience, regulatory sciences, all of that comes together to get to this vial containing a vaccine. And that scientific process is also half inner company, half outside, because we do clinical trials. And the clinical trials, we count on the clinicians. Today, for our vaccine, we have 200 clinical trial centers in the world, half of which are based in South America, to recruit people into the study, to commit them to participate and learn us whether it works. So it's a collaboration all over the place. But when it comes to producing and making sure you bring a high quality vaccine or a medicine or an antibody, that's where in industry we have the means and the capabilities to do it.